What's up, Warriors? Welcome back to another episode of the Suburban Warrior Podcast. I'm your host, Crissy Pyfer, back this week with another amazing Suburban Warrior here to share her story with you. Before I introduce our amazing guest, I want to remind you all to go to the suburbanwarriorpodcast.com to download your free From Pause to Power roadmap. And it's there that you can also sign up for our weekly newsletter. And this newsletter is amazing because it really highlights all the top points from each week's podcast so you do not miss any information that is coming your way. So let me introduce to you Dr. Andrea Matsumura. She is a double board certified internal medicine and sleep medicine physician and is a certified menopause practitioner through the Menopause Society. She's internationally recognized as the leading expert who elevates sleep as the most essential pillar of midlife health and the foundation of hormonal balance, metabolic vitality, brain performance, and overall quality of life. She delivers evidence-based insights and real-world strategies that women cannot find anywhere else, bringing clarity to the science of sleep hormones and aging and guiding women into a new standard of well-being grounded in truth, results, and transformation. Welcome to the podcast.
Thank you for having me.
Absolutely. I'm so excited for this conversation because I love talking about sleep. It is, as we get older and older, and especially in middle age, I think we all as women have realized just how critical and important sleep is and just how elusive it can be for us sometimes. And, you know, to your point, it is such a science and it is such a pillar of our health that, you know, I think when we're younger, we dismiss it. Obviously, in our 20s, when we're in college and starting out working, obviously, you know, as a resident, not really giving it the credit it deserves. And then as young moms, it really doesn't. And then in midlife, it just kind of comes back and says, you know what? This is what you get for not giving me the attention I deserve. So I'm really excited to talk to you about it today. So first of all, tell us a little bit about you and sort of how you realized that sleep was your passion and that's where your purpose was.
So I started out as an internal medicine doctor and practiced that for a little over 12 years. And, it really struck me that almost every patient that I would see at the end of the appointment or even in the hospital, they weren't getting enough sleep. And everybody would say, hey, you know what? I'm not sleeping great. Can I get something for that? And as a primary care doc, I dutifully would write a prescription, but then never really asked, all the important questions about sleep. And folks would then either say that it wasn't working for them or that they needed a different medication. And it was really kind of an afterthought. And it wasn't until somebody actually that was a patient of mine who had a serious accident at work, they ran their forklift into a wall at work.
Wow.
That then, I thought, how could this have happened? And realized that this person had untreated sleep apnea, that they had the diagnosis of sleep apnea and they had not had a follow-up around sleep apnea and they weren't treating their sleep apnea and they fell asleep basically at the wheel. Wow. So then I started reading more about sleep and realized that it was a newer field. So it's about 60 years old. And then I went back to school and I did a fellowship in sleep medicine. And then I started working for a pulmonary critical care. I became a partner at a pulmonary critical care and sleep specialty office and quickly became the women's health expert on sleep because women were coming in and, good, better. Otherwise, a lot of my partners would say, oh, thank goodness you're here. We don't like seeing the sleep patients. Oh, thank goodness you're here. We don't really like seeing the women who come in because we don't know what, they don't come in with any specific symptoms. And I started carrying tissues around with me because as I would evaluate their sleep and ask all these questions, people would break down, women specifically would break down crying, saying, I have been struggling for 8 years, 10 years, 15 years, 20 years, and no one could really help me. And here we are working through all of the issues around sleep.
Wow. And is that because, in the clinic, women were coming in and presenting differently because they didn't have, true, sleep apnea symptoms? I think a lot of men, a lot of times have more just true sleep apnea. Were women just coming in with more unspecified symptoms.
Yes. So,
Yeah.
let's think about that for a minute. We always classify women's symptoms as atypical, but actually they're typical for us.
Right, right. I love
Okay.
that.
So,
Yeah.
right? It really chaps me when I hear that women present atypically. No, we actually present typically for women. We just haven't
Right,
studied it. So we
right,
don't present atypically for chest pain. We don't present atypically for sleep. We actually present typically the way we're supposed to present.
right.
Okay.
Absolutely.
We just
Yeah,
haven't studied it, and it's not taught in medicine.
yeah.
I mean, in medical school, you get about an hour max on sleep medicine, and you don't really get any training, maybe afternoon talk on sleep medicine in residency, like an afternoon 1 hour talk. That's
That
pretty
is
much it.
crazy.
So,
Crazy.
anywhere between 2 and 4 hours, maybe you're getting taught about sleep medicine through an entire medical school and residency journey. So
Wow.
what we need to really do is get get this in front of healthcare providers, because when healthcare providers start talking about an issue, then it becomes important. And I am, at the beginning of all of this, it was kind of fun that I was the only person talking about women's health and sleep, but it's kind of lonely. I'm
Yeah.
kind of
Now
sitting
it's
here on an
exhausting.
Yes, now I'm sitting here on an island begging other sleep providers to focus on women's health so that we can change the criteria, so that we can develop criteria for women, so that we can develop screening tools for women.
Yeah.
Because we aren't atypical, we're typical for women. And you're right, women present differently. We have fragmented sleep, we have insomnia, we have those middle of the night awakenings. We sometimes feel depressed because we're sleepy, or we're sleepy because we're feeling depressed. We sometimes have snoring, but we don't typically have the big bad apneas. We don't
Yeah.
typically have loud snoring. Those are seen in men, those symptoms, and it's in every screening tool. So we're missing women with the tools that we have, because all those screening tools have really focused on men's symptoms. And the one that I use as an example all the time is the classic screening tool called the Stop Bang, and G stands for your gender. So you automatically lose a point if you're a woman.
Wow. That is crazy.
Yeah.
I mean, I'm still in shock, to be honest with you, that you get such little training on sleep, in medical school. I mean, I knew there was little training, in menopause care and, women in general, but like to sleep, I mean, sleep is one of the core pillars of our health and how we function, so that is shocking. So let's talk about specifically for women in midlife, and why our sleep at this age, like what happens to us that starts to interrupt our sleep. Because I'm envisioning like sort of the picture that you painted for us of like these women
Mm-hmm.
coming into your office and you had tissues because they're crying. And I can totally see that, and because I've been there, and I feel like it's because women, don't really know that they're having sleep issues, but they know that they're tired and they have brain fog and they can't really function during the day, and they're trying to sleep and they're wide awake and they're trying to get back to sleep, but they're not, I don't think, as classically like labeling it like men would do, again because they don't have the big snoring
Right.
issue, and which everyone knows is sleep apnea. So tell us from your perspective, what is really happening in our bodies that is causing us to have disrupted or inefficient sleep.
Right. Well, okay, first and foremost, I'm going to say why I'm doing what I'm doing, and that's because there is this normalization in our society that women have a high can suffer more,
Right.
basically, through every decade of life, whether or not that's sleep being affected by menstruation, sleep being affected by pregnancy, sleep being affected by postpartum, sleep being affected by the mental load. and now here we are, sleep being affected by perimenopause and menopause. And so when we have this shift in estrogen, progesterone, testosterone, and melatonin, because melatonin is also affected as we age, which was not taught in my sleep medicine fellowship, then it affects our circadian rhythm. So the circadian rhythm is basically the pacemaker for sleep and wake. Yeah. And, again, the call to action is prioritizing sleep, making sleep the most important thing in your life. Because if you don't sleep well, you can't exercise the way you want to. You don't make the decisions that you want to make around food intake, because there's data that supports that you pick the wrong foods when you're chronically tired, right? So
absolutely,
it's the three core pillars of longevity is there's no hack, there's no supplement stack that's going to that is the longevity, magic star. It's really the three core pillars, which is sleep, exercise, and eating for health, right?
Yeah.
And so, but without the sleep, then you can't build on the other two. So that's the key here. And so when you have the loss of estrogen, that really helps to sustain the circadian rhythm. It actually helps with REM sleep. Progesterone actually helps with the support of the soft tissue structures at the back of the throat. It helps to prepare the brain for sleep. And when you're removing the estrogen and the progesterone, then you have shifts in other hormones in your body. And the one that gets the most publicity, so to speak, is the cortisol. And
right.
I'm trying to balance it because I don't want us to demonize cortisol. Cortisol does a lot of good things in our body. It's just that it's off kilter because of our other hormones being off kilter. So it's kind of like everything needs to get readjusted. So cortisol, while it has a change in its spike, which can contribute to middle of the night awakenings, there's a number of things that are contributing to that middle of the night awakening.
Yeah. And do you find that one of the I guess I would say the most common symptom for women in midlife is the midnight awakening?
So
like when it comes to different sleep disturbances, right? Because there's
Yeah.
you could have trouble falling asleep, but I feel like the midnight awakening and then not being able to fall back to sleep, I hear that a lot. Is that what you see as well?
Yeah, the middle of the night. So anywhere between 2 and 4. I think that is what is the most worrisome for people because it's the most difficult to actually fall back to sleep. And it's usually in the middle of your sleep cycles. So it affects your daytime the most. But I will say this, talking about sleep disordered breathing, it triples or even more when you're in menopause. So over 50% of menopausal women have sleep apnea. 90% don't know that they have it.
Do you have to? I love. No, I think that's such a great point, and I'm curious. Do you have to be overweight to have sleep apnea? Because I
No.
think when people think about sleep apnea, they have a picture in their mind of someone who might be a little overweight, can't, sleeps on their back, and I think that's probably not true. So tell us a little bit about that.
Yeah, so as we age, again, the tone in the back of the throat changes, and then there's other factors involved around estrogen, progesterone, testosterone, and melatonin that affect sleep, and breathing abnormalities become much more common in the menopausal woman, even if you're taking hormone therapy, even if you're treating the changes, you still have an increased risk. There, of course, there hasn't been any big landmark studies or enough data out there to say, oh, if we give people menopause hormone therapy, that could potentially cure sleep apnea, because there's plenty of women who are on hormone therapy that still have sleep apnea. It's kind of all over the place. We just don't have good tools to really identify those that are at high risk, other than the fact that they present with symptoms like middle of the night awakenings, just generally fragmentation of sleep, depression, daytime fatigue, mild snoring, waking, but women
Yeah.
don't typically wake up with a dry mouth. They don't have witnessed apneas. They're not, morbidly obese for the most part. Most women,
Yeah.
who are presenting with mild to moderate obstructive sleep apnea in midlife.
Okay. And so tell me how sleep is like really affects our, let's say, brain health. Because I
Yeah.
know it affects, metabolic health, hormonal health. I want to go sort of through each, but let's start with brain health because brain health, but also brain fog, because I think brain fog is such a problem for women in midlife that, I know from my clients, it's like one of the top symptoms that we're dealing with. And it's a tough one to, address. So
Yes.
how does sleep directly affect brain health?
So the key around sleep is not only quantity, but quality. And so
Yeah.
it's cycling through the stages of sleep. And literally almost everybody's got, an Aura ring or some other wearable device. And that data is good around trends, but it is not a diagnostic tool. And so I would say a nugget in this podcast would be not to use that data on a daily basis, but to look at trends over a week or 2 weeks or a month to see if something is bubbling up as really consistent. And then having a conversation with your provider. Is this something I need to worry about? Because they're oversensitive. You might have some dips in oxygen saturation, but maybe they're only for a few seconds. They're not for minutes or, 1 or 2 seconds versus, over 10 seconds of time is different, very clinically different.
Yeah.
So the key about wearables is take them with a grain of salt. They're not diagnostic and they are an opener to a conversation. They're not, please don't jump to conclusions about your sleep.
I actually love that you said that because one of my questions was going to be about trackers because I have worn a Aura ring for years. But I always I would wear it for like 6 months and then I take it off, and I wear it for like 6 months and I take it off, and I went on it when I was in perimenopause and really struggling, and it helped. But now that I'm feeling much better, I feel like it's almost too much information all the time. And I feel like they're good for certain times of your life. And to your point, to take the information and then maybe do something with it. But I love your point about it's information. You sort of have to take it with a grain of salt and then maybe dive in further a little bit, but it's not the end all be all. So I think that was a great point. And I appreciate that very much. So, okay. So now tell me about the brain, sleep in the brain.
So sleep in the brain. So again, it's cycling through the different stages of sleep. And you really do need all stages of sleep. But the ones that are really talked about the most are your deep sleep, which is stage 3 sleep. And that's where you do most of your, for general purposes, physical repair.
Yeah.
And then REM sleep. And that's where you do a lot of emotional regulation, memory consolidation. And so those are the two biggest stages of sleep. And why are they important? So stage 3 sleep is important because that's when your lymphatic system turns on, and that's when you're cleaning all the waste products from the brain. So my analogy is that it's like a dishwasher, okay?
Yeah.
So when you turn your dishwasher on, and the first part of the cycle is rinsing the dishes. That's like stage 1 and 2. It's getting the dishes all ready to get scrubbed. And then stage 3 or deep sleep is when when you're actually doing the scrubbing cycle of the dishwasher, when you're cleaning all of the dried, caked on, food, all the food remnants are being removed, right? And then REM sleep is when you're rinsing the dishes and drying them, and so that they can come out of the washing machine. And who hates to open up their dishwasher and there's some caked on food on a plate, or they're all soaking wet,
right?
Or they're all soaking wet.
Yeah,
right.
Yeah, it's such a great analogy because no one wants that.
Yeah. So it's getting through the stages of sleep that are really important. And a fun fact, that's not linear. So you walk through the different stages of sleep and you go from stage 2 to REM sleep. Stage 3 sleep is generally happening in the first 1/3 of your sleep, and REM sleep generally happens in the last half of your sleep time. So that's why it's important, and that's why the American Academy of Sleep Medicine, through a ton of population data, hangs their hat and recommends 7 to 9 hours, because all this population data showed a U-shaped curve. So problems, disease states, when you didn't get enough, higher, and then it bottomed out, U-shape, and then it came back up when you got too much sleep. So too much and too little is not good.
Okay. Yeah, that's really interesting. And I do think that a lot of times people overestimate the amount of sleep that they get. So I think if they're like, yeah, I get 7 hours of sleep, they're probably actually only getting like 6.5 or so by the time they actually fall asleep and, all that stuff. So basically then, if you're not cycling appropriately through those stages of sleep, you're waking up still feeling tired, feeling that brain fog, not feeling refreshed. You still have that sort of gunk on the brain, wet brain, whatever you want to call it with the dishwasher analogy, because you haven't really gone through all the cycles. So that's why, doing that is so important. And I guess, does the same apply for hormonal health and for just overall metabolic health?
Yeah. So, so our body, I like to say, is a symphony, right? And so if you're trying to play a song in the wrong key, it doesn't sound really good, right?
Yeah.
So that hormonal health, there's times when hormones turn on, there's times when hormones turn off. And if we're not getting at the right stages of sleep, then we're at a disadvantage. And so that's why we want to not only have quantity, but also good quality. And there's some emerging data coming out, some good published articles around the fact that quality is going to be more beneficial sometimes than quantity. So again, if you have some sort of other medical disorder that's affecting your sleep, and even though you're getting 7 to 9 hours of sleep, if it's bad quality, then it's not really going to be that great.
Yeah, because you're not waking up feeling restored and ready to go.
Right.
Yeah. Okay, talk to me a little bit about melatonin, because I would love to I want to know more. Now, I want to understand, a little bit more about how melatonin works in our brains, what it's signaling, and how it is affecting sleep.
So melatonin is the signaling hormone for starting the sleep cascade. So it's a clock starter, first of all. It is not a sleep aid. It is sold over the counter as a sleep aid, and it affects the physiology that's already in motion. So I want to be really clear, supplements in general, especially for sleep, but really for anything, they're not cures. They're helping to support the physiology that already exists. So I caution folks, that's another thing that I'm repeating over and over on my social media accounts, is that supplements are not cures, they're affecting physiology. And so melatonin, we lose melatonin production as we age. And melatonin is really governing that sleep wake cycle, the circadian rhythm. It's the hormone that is supporting the circadian rhythm. So there is some data out there, not a lot, and clearly not any big randomized, high level controlled study, but it may be worthwhile to support the normal aging process with a small dose of melatonin if you're starting to have some changes in your sleep. I will caution though, please don't do things in a vacuum. Get your whole sleep evaluated, because you don't want to miss sleep apnea. You don't want to miss restless leg syndrome. You don't want to miss chronic insomnia and the underlying drivers of chronic insomnia. But it may be a potential beneficial hormone supplement. So melatonin's a hormone. It does change in production and reduce as we age. It also has other effects in the body. So it's got oxidative principles to help with free radical production, which is basically the waste products that we develop
Yeah.
in our body. It may have some cardioprotective effects. So it does a whole lot more than just help us sleep. And but again, the supplement world is really, I mean, I came out with a supplement for
Yeah.
sleep, but it's to protect the physiology. It is not because you need a cure. I really want people to understand that they really need to be going to their healthcare provider to discuss sleep issues, and it may be so I see melatonin as like potentially the next vitamin D. So
Yeah.
nobody bats an eyelash at taking vitamin D. We now know how it helps with bone density. It's a hormone. But it's sold as a supplement, right? Well, melatonin is a hormone. And when I think about hormones, generally speaking, like estrogen, progesterone, testosterone, depending on how we use it in our body, if our thyroid stops working, that's a hormone. We replace it.
Right.
If
Right.
our pancreas stops working and stops making insulin, we replace it. Nobody says, well, you shouldn't take thyroid medicine because we know it improves life, right?
Right.
So it may be worthwhile to take a little bit of melatonin if you're starting to see more fragmentation of sleep. That might be beneficial, but you want to take it strategically. You don't want to take it right at bedtime. You don't want to take a whopping dose. There's a
Yeah.
lot to melatonin. It's
Yeah.
complex.
Absolutely. And that's why I asked the question, because I feel like there's a lot of misinformation out there about melatonin.
Yes.
So I wanted to hear straight from the sleep doctor, because I do, like, again, we hear a lot about women in midlife with estrogen, progesterone, testosterone. Yes, we hear a lot about cortisol. But melatonin, I really think that there is misinformation out there that it is a sleep aid, and it's not a sleep aid. And my understanding of it was, in the simplest terms, is that it is a signaling hormone that it is time to sleep, and sort of what you said, but it's not going to help you sleep and stay asleep, kind of thing. So I think, and I know that melatonin has a lot of wonderful benefits, but it may not help you stay asleep all night. So again, just understanding the supplement that you're taking and why you're taking it. And I love also what you said about truly getting evaluated and understanding the root cause of what your symptom is and why you can't sleep to begin with. And then, yes, of course, if you need supplements to fill the gaps, and melatonin might be one of them, great. But first and foremost, understanding why you're feeling that way to begin with, I think, is so important.
Yeah, it is. So melatonin, we release it from our pineal gland in the brain, and that the pineal gland is the first gland in the body to calcify, which is why we have this reduction in
Ooh,
melatonin.
okay. Oh,
And
that's
so,
depressing.
yeah, yeah, right. So, I mean, it's released 3 to 4 hours before bedtime. So it's a clock starter. It
Yeah.
is not a sleep aid, right? So typically, if you're going to take a supplement, you want to take anywhere between like 1 and 3 milligrams sustained release, because it does stay sustained high in the body, and then it starts to wash out a couple of hours before we wake up. And so that's how you want to take it, at least a couple of hours before you're going to go to sleep, which is kind of hard for most people who have busy lifestyles. But we this
Yeah.
is a reason to use the phone for good, which
Yes,
is
yes,
setting an
yes.
alarm to
Yeah,
say, oh, it's time to take this medicine, to take this supplement.
exactly. And I also have heard, and you tell me your thoughts on this, about like, and it's just ironic I'm asking this question because I am very jet lagged right now because I just got back from Florence late
Oh,
last night.
wow.
But I have heard that, and I have not tried it personally, but that if you are traveling abroad or through time changes, that
Yes.
melatonin can help to sort of ease that transition a little bit for you when you're trying to adjust your circadian rhythm to a different time zone.
Yeah, so the two things that govern your sleep and wake are bright light and melatonin. Using them strategically can help reduce jet lag.
Okay.
So typically, I provide people with like a little protocol to, figure out, okay, where's your destination time? What is your destination time? Where are
Right.
you? And then how do you adjust your sleep cycle a few days before to reduce jet lag? How do you strategically use sunglasses to block out light? How do you
Yeah.
strategically expose yourself to light so that when you arrive at your destination, you have less jet lag, and then vice versa. So it's all about physiology
Yep.
and timing. So it's a combination of physiology and precision in how you use these basic core principles. And then I always talk about like setting yourself up for success on a flight, like my low budge jet lag kit.
Yeah.
Prevention kit is an eye mask,
Yeah.
earplugs, uh, you know, um, wear layers because planes can get cold, right? Or sometimes you get hot,
Yeah.
but have easy to remove layers. I tend to wear compression socks when I travel,
Okay.
and those are the kind of core components. And I don't care how I look on a plane. I got my eye mask. I've
I
got
love it.
my layers, and I also take something to support my spine. So especially if you're flying overseas,
Yeah.
you usually get a pillow, but I usually take a blow up pillow. I just take like a little tiny blow up pillow to support my upper back, and I use that other one to support my lower back. There's all kinds of devices, the big ones that
Yeah.
are around the neck. What I think it's worthwhile to support your spine, but also like avoid all the sensory, like the
Yeah.
noise, the eye mask, and plan it around your trip so that way you can be strategic about your sleep. Avoid alcohol if you don't want to avoid alcohol, because a lot of us,
Yeah.
even though there's a lot of data out there, but if you're going on vacation, you're going to want to, a lot of people want to have a
Yeah.
drink. It's vacation
Absolutely.
mode. So I say to folks, okay, hydrate. Like drink a glass of water, have a drink. Drink a glass of water, have a drink, and be mindful about it. Like set yourself up for success. If you know alcohol prevents you from getting to sleep, well, you're not doing yourself any favors,
Yeah.
right? You have to make
Right.
that decision for yourself.
Yeah, yeah, absolutely, absolutely, and that's great advice. And I definitely do the budget, travel abroad with the eye mask and the earplugs and layers, and but that I mean it helps so much because I really do feel like if you're trying to be strategic, you have to be dark, no sound, and really try to sleep. So I think that's great advice. Okay, tell us a little bit about the dream sleep method.
Okay.
That is your method. I want to know
Yeah.
more about that.
Yeah. So it's a method that I developed for other healthcare practitioners, but also for anyone who really wants to dive deep in their in understanding how their sleep is being affected rather.
Yeah.
So D stands for daily habits, R resting environment, E emotions, A archetype or circadian rhythm, and then M for medical conditions. And so when you think about sleep, like for instance, I get a lot of questions about the middle of the night awakening. What is the punchline? Why
Right.
why aren't you giving me the one solution for helping
Yeah.
me not wake up in the middle of the night? And that's because it's not one thing. So, daily habits, what are you doing during the day that could be affecting your sleep? Are you hydrating correctly? Is your nutrition okay? Are you, giving yourself time to exhale? Are you having some downtime? Are you exercising? How are you setting yourself up to get to sleep? Because good sleep doesn't start at night. It actually starts when you wake up, how you
Right.
prepare yourself for the whole day. Resting environment. So, is your bedroom, set up for powering down? Like, do you have a big TV in your room that you turn on? Are you bringing your phone into your bed? The one simple act of not climbing into bed with your phone changes everything. Even if you have to put it on your nightstand fine, but do not climb into bed with your phone. And that's so
Yeah,
hard.
so why is that? Because let's be honest, I think everybody who's listening probably climbs into bed with their phone,
Yeah.
even though they know they shouldn't. But um, why is that something we should be avoiding?
Because of the light and the how it turns your brain on. So even if you
Yeah.
use, the fancy program in your phone that's blocking out light that is alerting, you're still exposing yourself to some light.
Yep.
And you're reading and doing things that are firing your brain off that says stay awake.
Yeah.
You're not doing, even though it's people will say, well, it's really relaxing. I like just scrolling. Actually,
Oh,
that's
there's a
turning,
million excuses that we could come
yeah,
up with.
that's,
My kids might be like calling
yeah,
me, or oh, I read on my phone. It's relaxing. I'm meditating. I did like, I mean, there's a million. There's a million reasons why we want to say we should have our phone in our hands,
yeah.
but it's so not good for us.
It's not good for us. And think back, most of us who are Gen Xers and
Yeah.
millennials, we didn't grow up with electronic devices, or it
Nope.
was, after age 10, definitely, maybe 15.
Oh,
Think back to those times. And I was listening to something online. They asked a bunch of Gen Xers, if you could go back in time, would you grow up with phones, or would you say nope, I don't want phones in my life? And 100% every person said no way would I ever want to have a phone growing up.
no way. I know. Oh, 100%. I mean, I agree. I agree. I mean, I have kids, that they're like, we wish we didn't have these. I mean, they really do. It's just too much. It is. It's there's some benefits to the phones, but it is just too much, and it really it takes away from being present in our lives, and that's I think the hardest part,
Yeah.
is we're not present and enjoying like what's right in front of us all the time, which we got to do because we didn't
Yes.
know any different. So okay, so obviously the right sleep environment at night, putting your phone somewhere on a table in your room and not climbing into bed with it is a huge start in the right direction.
Yeah. The room should be dark, cool, and quiet is basically the three things that I always say: dark, cool, and quiet.
And when you
Not
say cool, what is cool?
You know, it's different for everybody, but generally we do have a reduction in our core body temperature that actually helps us get to sleep and stay asleep
Yeah.
by about a degree and a half. And so we really don't want it to be too hot. That actually doesn't allow us to get into all the right stages of sleep, makes us have more fragmentation of sleep, and then sometimes you wake all the way up. So
Yeah.
that's why you want it a little bit cooler. That's really and you do not want light. You want to signal to your brain that the bedroom is the time that I need to power down and get to sleep. And so that's why also the E, I'm going to move to the E,
Yeah.
emotions. I always say you should be sleeping alone, and that's, figuratively sleeping alone,
Yeah.
meaning when you cross the threshold, when you're walking through your bedroom door, leave all that emotional baggage at the doorstep. Don't bring it into your bed. Why are you sleeping with all this extra baggage that is
Yeah.
affecting your sleep? You actually do have power and control to tell your brain, your mind has to tell your brain, knock it off. Like,
Yeah.
stop bringing all that stuff into the bedroom,
Yeah.
because that is a big driver for insomnia. A lot of people have sleep anxiety, meaning that they don't look forward to getting into bed anymore. They are worrying about getting to sleep.
Yeah, because of the rapid thoughts and the
Yep.
emotions that once you actually quiet down, and or you go to lay your head on that pillow, that's when the racing thoughts start, and
Yes.
and that can cause additional anxiety.
Yes.
Yeah,
And cause wakefulness,
yeah,
or contribute to it, and then your body starts to adjust to that and stays more in that sympathetic mode versus parasympathetic mode, and it's a cascading effect. So then the other one is archetype or circadian rhythm. Are you following your circadian rhythm? Are you working against your circadian rhythm? And I have a quiz on my website to determine whether or not you're an early bird, a night owl, or somewhere in between.
Okay.
And so that helps people kind of understand who they are. I just saw a patient on Monday who has taken all kinds of medication, high doses of sleep aids, and when it comes right down to it, they have a significant delay in sleep, but they can follow it. So this person wants to go to bed like at 3 and wake up at 11, and their lifestyle is such that they can actually wake up at 11. They don't have any pressing issue to wake up earlier, but they're getting into bed at 10.
Oh, wow.
Taking a huge sleep aid, tons of it, and they still don't go to sleep until 3, but they're lying in bed watching TV, using their phone for literally almost 5 hours. And they did take an Ambien right at bedtime, 10 o'clock. And I said, that's because you're fighting your circadian rhythm. Yeah. And inevitably, they end up having fragmented sleep. And then the person said, I get my best sleep between like 7 and 11. And I said, that's because that's that second half of your night.
Yeah.
And you're getting all that REM sleep during that time. And you don't get out of bed until 11 anyway. So don't go to sleep until like 3 o'clock.
Right.
And it's like this light bulb went off in their head, and they're like, oh my gosh, I could really do that. Yeah, you're not getting out of bed until 11 anyway. Why are you
Right. Right. If that's not the issue, follow your circadian rhythm.
Yeah. But there's ways to adjust your sleep cycle. So if you're a night owl and need to get up early, there's ways to adjust it strategically. That's a whole another topic and full handout that I have for people, but that's key. You have to know what your circadian rhythm is and if you're following it.
So then this woman's circadian rhythm would be the night owl.
She's a night owl. Yes.
Yeah. Okay. Gotcha. Yeah.
And then when we talk about medical conditions, right? There's a lot of medical conditions that can affect sleep. We know that when people have heart conditions, it affects sleep. We know that when people have autoimmune disorders, it affects sleep. We know that when people have neuromuscular disorders, it affects sleep. We know that depression and anxiety affects sleep. We know that hormone changes, any kind of hormone in your body can affect sleep. So restless leg syndrome, and of course,
probably
breathing.
I was just going to say other medications that they might be on, side effects from other like pharmaceuticals, pain. Yeah, absolutely. Yeah. So that is really a big one that people probably aren't attributing to something else that is causing it. It's just thinking that that's a symptom that's on its own, that they can't sleep, but it really could be very much attributed to another medical condition that they're having.
Yes.
Okay. Yeah, that makes a lot of sense. I mean, it really does. And, thinking when you're really going through all of those things, it's really mind blowing how many different aspects of life can affect your sleep. And we wonder why people aren't sleeping.
and part of it is that it's this layered effect in our society where we have added more and more to our plate, and it is affecting our sleep, and why I came up with this method. Yeah. Because it's kind of important to address all of these things that maybe weren't important or prominent in society, 100 years ago, but are now prominent in society. So we need to pay attention to all of those things.
Absolutely. What are your feelings on caffeine?
So caffeine has both alerting and stimulating effects of the brain. It has a half-life of around 6 hours. There is plenty of data that shows if you drink it too late, it does reduce and shorten your sleep time by about 30 minutes on average. When people tell me, I can have a double espresso and go right to sleep, I tell them, you just confirmed to me that you're chronically sleep deprived.
Yeah.
Doesn't mean that you're immune to the effects of caffeine.
Right. Okay. That makes sense, because I hear that as well, and I'm like, damn, because I can't do that. And I always wonder how some people, I'm like, maybe that's just how their brain works.
No, no. So we have caffeine receptors in the brain, and then we also, caffeine works against adenosine. So adenosine is a waste product that builds up in our brain, and that's what makes us sleepy as the day progresses. And so when we drink caffeine, it is competing for the same neurotransmitter. It's competing for the same to attach to the same neurotransmitter as adenosine. So
right.
Yeah, it's an antagonist.
Right. Okay. So caffeine earlier in the day, okay. Everybody should still be trying to avoid it as the day goes on if you're trying to sleep.
If you're trying to sleep, I generally tell folks if you go to bed around 10 o'clock, you really should stop drinking caffeinated beverages by 3 o'clock at the latest.
Yeah. Yeah. That makes sense. That is absolutely the case for me. I cannot have caffeine after 3 o'clock if I want to fall asleep. Well, tell people where they can learn more about you and your practice.
Yeah, so I am a physician advisor at this point in time, and I do see patients through a closed system at this time,
Yeah.
I have a full panel, but people can get lots of education and information on my website. That's AndreaMatsumuraMD.com. I also have an Instagram account that I provide lots of tips and tricks, and it's really about raising awareness and giving people the agency to go and have these conversations with their healthcare provider. I've got a newsletter that you can sign up for that helps educate people around sleep, and I have a book that's coming out in 2027 that's going to be on women's health and sleep, and an educational course that'll be coming out at the same time, one for healthcare providers and one for the general public.
Wonderful. And I know you do have a supplement that you have partnered with Dr. Mary Claire Haver with.
Yes.
And so tell us, because I know that melatonin is just a piece of what is in that supplement.
Yeah.
Tell us a little bit about that supplement.
Yeah, so again, it's to support known physiology, and we decided that we wanted to only have 3 ingredients in it. I'm not a fan of supplements that have a ton of ingredients in them. We also picked 3 ingredients that have been well studied, that has a lot of published data for efficacy, purity, and we went ahead and went with a sustained release melatonin, that's 3 milligrams. And then we have L-theanine and we have magnesium bisglycinate. So the L-theanine is to help support GABA and the GABAergic potential, meaning that it helps to relax the brain. And then the magnesium bisglycinate, there's a whole bunch of different magnesiums out on the market, but bisglycinate in particular is very easily digestible, doesn't really have a whole lot of tummy side effects, and it really helps to relax the body. So it helps, it does muscle relaxation. So we did relaxing the body, relaxing the brain, and then circadian support with melatonin. So those are kind of the 3 components.
Yeah, that's amazing. That's wonderful. It sounds like that will really help support a wonderful night's sleep. Well, that is so great. Well, thank you so much for being here. I love talking about sleep because I really do feel like it is something that women in midlife are really struggling with for many different reasons. And I think you provided a lot of clarity around what all of those reasons could be, and that, fixing it, quote unquote, isn't a one size fits all. And, we have to look at our sleep hygiene, the dream sleep method. I would encourage all of my listeners to go to your website, which we will link in the show notes, so that they can take the quiz to really understand what their circadian rhythm is. And, listen, once we're all sleeping better, we're just going to all feel so much better about everything else in life, because sleep is everything. So thank you so much for being here and sharing all this great information with us.
Thanks for having me, Crissy.
Yeah, absolutely. Guys, thank you so much for listening. Please don't forget to drop us a comment. Let us know what you think of this episode. Be sure to click that follow button, and we'll be back next week with another amazing suburban warrior here to share her story with you. Till next time.